Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness. Welcome, everyone, to our Birds, Bees, Bodies podcast brought to you by Planned Parenthood of Southeast and North Florida. Happy Pride Month. This is super exciting to be able to do this podcast. We're talking about Pride Month today and LGBTQ healthcare all across our state and really just in general. We have a great show ready for you all. We have great guests on this call as well. So I'll just start off by saying, I'm the VP of Communications for Planned Parenthood of Southeast and North Florida. My name is Michelle Quesada. I use she, her pronouns. And we have several people on the call today from Dr. Cherise Felix. She's our staff physician at our affiliate, our organization. We have Samantha Cahan, who is our program director for trans and non-binary care. We have Andre, who is a peer educator coordinator with our organization. And we also have Mitch, who has been a patient of ours for our gender-affirming care services and is here to talk about today, Pride and all the things that go into LGBTQ plus healthcare. So we'll start off with Dr. Felix. If you want to share a little background on yourself and what brought you to this work, and how we incorporate, all things Pride this month, especially our LGBTQ plus healthcare.
Okay. Hi, I'm Cherise Felix. I'm an OBGYN and I am relatively new to Planned Parenthood of Southeast and North Florida. I've worked off and on with Planned Parenthood and other clinics for several years now. But I recently moved here from Tennessee. So when our abortion laws changed in Tennessee, I started looking for other places and I came to Florida. And when I joined this affiliate, there was the whole gender affirming health, hormone therapy portion of the service line, and we didn't have that in Tennessee. So I was pretty interested in it, and Sam has done an excellent job to kind of bring me current and help me be more of an asset to the community. So we didn't have a lot of offerings in the state where I came from. So this has been pretty nice to be a part of it.
Awesome. Thank you. Andre.
I'm Andre. My pronouns are he, him. I've been with the affiliate a little bit over a year now as an educator. And what got me into this work was really just my continued history of working with youth and working towards youth empowerment. So I've got backgrounds in mental health, I've got backgrounds in foster care, and in all work that I do, trying to not only connect youth with resources in their community to to survive and thrive, but then also providing them with education so that they can just make better choices and to carry on the legacy of their ancestors in a sense, and do better with the foundation that we laid for them.
Hello, everybody. My name is Samantha Cahan. My pronouns are she, her, and I'm the program director for trans and non-binary patients for Planned Parenthood of Southeast North Florida. And I started this line of work, I'm going to say 4 years ago. I've been a nurse practitioner going for, I believe, 7 years. About 4 years ago, they were looking for a program director. And I was really interested in learning more about the community, how I'm able to help, especially since there's so many barriers to access for their care. And I figured, why not better than to learn about it and be able to spread the word and show like that recognition throughout the community. So I jumped on and said, sure, I'll go ahead and do it. And I have a huge passion and love for it because I've been helping people, even despite the barriers that we've encountered here in the state of Florida, somehow, some way, we're still managing to help our patients. And that's what I'm here for, to help and hopefully provide more access to patients and their care.
Wonderful. Thank you, Sam. And Mitch, if you want to tell us a little bit about yourself and what brought you to Planned Parenthood.
Yeah, sure. My name's Mitch, he, him pronouns, and I've gone to Planned Parenthood for like about 2 years. So basically, when I started my journey, and I've had wonderful care, and I think it's truly like a really good thing. I really enjoy going there. I don't feel that like doctor anxiety sort of thing. I feel like I'm just going to just talk to a friend.
I'm glad you mentioned that because that brings us to the first thing I wanted to talk about, just how Planned Parenthood is different in every way and shape or form, and how we offer healthcare to our communities. What we do is compassionate, comprehensive healthcare for all. And a big focus of that has been making sure that our LGBTQ plus communities in Florida feel welcome in a state where they're very often attacked and marginalized and everything in between. So, this is what we stand for at Planned Parenthood: being able to welcome everyone, no matter where they come from, no matter what gender they associate with, no matter their background, their marital status, sexual orientation, all of those things. But with the work that we do, we're not blind to the barriers that exist, have existed in healthcare for a long time. So I want to talk about that first, and not so much just, we know there's state barriers from policy and law that has been passed in Florida recently, but they're just barriers in general to healthcare, to getting healthcare if you're part of the LGBTQ community. Whoever wants to jump in and chat a little bit about that. I've heard different things from not feeling comfortable to going to a health center where everything's very gender conforming. There isn't a lot of openness to pronouns and accepting someone for who they are. So just different things that you've encountered, and anyone can jump in.
Yeah, for me at least, some of the patients have told me just transportation itself in general. We have a lot of patients, especially the trans non-binary community, that it's very difficult for them to find jobs, right, due to discrimination. And with that, no work, no income, it's hard to get transportation, right? So even transportation to our healthcare centers, it's a huge barrier for our patients. And again, despite like this, the state laws, via telehealth right now, right? They have to sign that consent first in person, etc. So what the access that they did have is taken away. So now we're looking at the transportation portion. So, a lot of our patients live in rural, small areas in which a Planned Parenthood could be 2 to 3 hours away, right? And I'm pretty sure like their local community primary care office is not affirming or know how to provide the care for transgender patients. So that's a huge barrier that I've come to notice, is just as simple as something as transportation.
I can speak more from just the clinical aspect and some of the evolutions I've seen just throughout my practice, and just to give a little bit more background on physician training. I'm an OBGYN, and there was no section in medical school, and there was no rotation during residency where any of this was presented to us. And if we brought it up, if we wanted to know more about even abortion services, or if there were any changes in how we should approach our lesbian population, let alone transgender, like that just was never brought up. So if we had questions, it was almost like, well, when you're done training, you can seek that out on your own, type of thing. So a lot of physicians don't have the background. I did not have the vocabulary, and I've been practicing for decades now, but I had no idea just some of the even like basic terminology. Sam taught me so much. I had a whole vocabulary list I had to go home with just to understand like what people were saying or what not to say. So for me, being a physician that actually is compassionate and I do care, I don't even know how many people I made uncomfortable just because I didn't have the training. So when I think about how uncomfortable that has to be from a patient perspective, if you had a physician that maybe wasn't as compassionate or didn't care as much, and they're still making those kind of mistakes because that's the standard and the norm for us, then that's a huge barrier for patients that are going to come in and try to seek care because you feel uncomfortable. And I'm sorry for on behalf of all the other physicians that don't know, and for the mistakes I continue to make. But there's a lack of education from our perspective. And so that gets perpetuated from how we were trained to how we move through life to how we treat our patients. So I feel really fortunate that I had a Sam in my life to kind of help, my bedside manner and how I approach patients. But that is a huge barrier for patients seeking healthcare. And I love it when I've got a patient that will say, I felt really comfortable today, because I know I wasn't always that doctor, even though I wanted to be and felt like I was. I wasn't always that doctor that made people feel comfortable because I didn't know what I was doing. But I can't imagine what my other colleagues are like that don't care, right? So if you think about that being the majority of physicians that are in position to receive a patient from a primary healthcare standpoint, like that's a big deal. Trans patients don't want to go. They don't want to have to deal with the humiliation at check-in, or talking to the medical assistant and trying to explain to them, and the uncomfortable pauses, and I don't know how to document that, and I don't know what I should say. Like, those types of things are hurtful. So I think there's a huge hurdle to, for our alternative communities coming in and just getting basic care, let alone gender affirming hormone
And
care.
it's funny you mentioned that too, Sharice, that like a doctor, sorry, Dr. Felix, that these patients are not coming in, and you see it like in the emergency rooms, right? And like you see the increase of like these patients getting sick because they feel that way. And when they tell you stories of like what a provider told them, you kind of sit there like kind of shocked, like, wait, what do you mean someone told you that? I can't believe someone actually, a provider who is a professional, went ahead and like spoke those words to a patient. And it's very shocking to hear that. And it's true. You don't learn that. Like even in nursing school, you don't learn that. In school for my master's for NP, didn't learn that. It's something brief now that it's being brought up. And I would love like if there's hospitals that would do training and basic, just vocabulary to make everyone feel comfortable when they go into the hospital.
The,
So
the first step to that is awareness. As Dr. Felix pointed out, she wasn't aware before, right?
mhm.
You were unaware, making mistakes. And then being accountable for it, right? Not only being aware, but then holding yourself accountable to being that physician that you want to be, not dismissive. I'd love to hear from Mitch, like on your experiences, before coming to Planned Parenthood. What are some of the barriers or things that you've noticed you have either experienced, or friends of yours, or just people that you know?
Well, yeah, I definitely could tell you that. Thankfully for me, I've been fortunate enough to have a mother who's very supportive. It was quite a bit, here and there, but eventually we got to where she can understand what I was feeling and why I needed that medical like assistance to really feel like who I am. And thankfully I was fortunate enough to have her. But for other people, like people in my in the community, trans community, especially in that time was more youth. um I think the big problem here is like people who don't have that supportive family. Because if you are like maybe around the ages from like 16 to 19, that's maybe the time that you should have your own car, more like transport and all that stuff. But if you have a family who's not supporting you, and they have the ability to take that transportation away, can't go on your own, or you can't even go in with them to really have that sort of like just outside support, external support. And I think that really puts a barrier for a lot of people, because a lot of people are people. They want to be with somebody. They need somebody to support them. But if they don't even have their parents, cousins, or just siblings, they have no motivation to even try and change, because they don't see them how they see themselves.
You're saying
So
it's harder when you're not independent already. I mean, no matter what, anyone, independent or not, needs support and needs people to stand by them. But you're saying it's even harder in that adolescence period when you depend so much on your caregiver, your guardian, your parent, whomever that might be, to be able to operate in life. And so now you don't have that support. It makes things so much more difficult to seek the healthcare provider that you prefer, right? That you feel
yeah,
comfortable with, and all those
exactly.
things.
Yeah, it becomes such a hassle within yourself to even get that sort of like urge to just kind of tell them like, hey, I want to try and go see, and maybe even get, et cetera, et cetera. And they just say, no, it's just something that it could really just cause them to really cut back and not be able to go for years and years. And people transition to their 20s, I've seen like people online say like I've had to wait till like I was 25 to get out of away from the family, away from the negativity. Then I can truly go to a medical professional and be like, hey, I need help. And I think that's a big barrier there.
Absolutely. And Andre, you do a lot of the educating, even with our own staff as part of the Include training. Tell me how you work with, the community and even educating parents and families on how to be more supportive, with LGBTQ communities and just how to be aware.
Mhm. Well, so well, in my previous capacity, when I was working in mental health, the big thing that I would always do is just remind parents that um, identities are not identities are not always chosen, right? And we need to look at how our values can influence our children's decision making. So, if you have a child, for example, like Mitch was talking about, who is non-binary, who is genderqueer, who is not, not some heteronormative label, and you don't know what to do about that, like that's okay, but you have to learn, because if that child doesn't feel supported, as Mitch said, like that can be a huge cutoff to care right there. They're going to feel necessarily confident enough to go out and ask for care. Part of what I do is I have a team of high school youth that go out into their communities to share information more one on one, more closely with all of their classmates, their fellow students, their fellow mentees, if they're in extracurricular activities, to let them know what's out there in terms of care. Regardless of identity, regardless of sexual orientation, just know that it's there, know where it is, and if nothing else, be the point person in their areas in the community for those folks to come to. But then more directly with parents, I have this workshop called Time for Your Teen, where we really get into sitting with yourself and looking at what your values are and learning how to communicate those values to your child. So the whole point is not to tell a child, not to tell a youth that something that they're feeling, whether it's an attraction, whether it's a an identity, whether it's a whatever, is that is wrong. But with that in mind, based on our family values, right, based on our community values, how do we navigate this in a way that is safe, that is healthy, and that is feels responsible for everybody involved. And that does start with the parents. So we have a lot of fun in those conversations. We also provide some sex ed. We do some role playing games so that they actually kind of get into the headspace of an adolescent and then learn how to communicate those things in ways that are non confrontational, non aggressive, not hostile, and are actually nurturing and supportive.
Incredible. And one of the things you mentioned was the parent being a huge support in that child's life, the parent, guardian, whomever is the caregiver, primary caregiver. Mitch, and I know this is different for everybody, but how early was it for you when you realized that you weren't comfortable, with the assigned gender you were given at birth? How did you know, and who did you talk about it to first? I know you mentioned that you have a parent who's very supportive, of your transition, but was it a mom or dad first, or was it someone else or an aunt or anyone else in the family?
Well, yeah, I kind of figured that around maybe as early as like 12, 10, 12, around that time. Because, well, stereotypical, male things like getting dirty, going like trying to play like sports and all that stuff. Like, well, all that is stereotypical. It did make me question a bit, because it made me feel like, that, oh, I don't know why. I don't know why I don't want to wear dresses. I just don't want to. And I would have to make excuses. The fabric's too itchy. Um, which I've now learned that most women do think like that, that their dresses are a little itchy. So, you know,
It's
but
terrible.
yeah,
I still
those
want
poofy
to know
dresses
who
really
invented
get you.
Yes, and the lack of pockets, the lack of pockets.
Exactly, exactly. It needs to be a change. But I think that's what really got to me. I had to make a lot of excuses to really just feel more comfortable. And I think I told some of my friends first that I just liked women, because my exposure to the LGBT was just lesbians and gays at that time. no one really talked about transgender.
What happens, and a lot of the patients that we see that we offer care to are already adults. When we are caring for adult patients who have delayed their care, whether that's transitioning or whatever care they were seeking, what are the impacts of that for them to delay care because they didn't have a support system or they didn't feel comfortable? Either Sam or Dr. Felix, if you want to answer that.
Especially,
What I've seen for some of those patients that come in later, like when we go to confirm pronouns, even they'll dismiss it from the start. They'll just be like, "Oh, that doesn't matter to me," So it's almost like they have minimized their identity for so long that when they get to your office and you try to validate or even just try to establish how you should move forward to them, they're just like, you can call me whatever. It doesn't matter. Like I hear that all the time. There's a lot more cynicism in the visit, a lot more, I don't know. I feel like the patients that do,
Like skepticism, you mean, about the care and
no, more cynicism, like when I'm trying to establish rapport, when I'm trying to talk about even the consent, the million-page long consent, like, when we talk about medications and when I sent the medications and prior authorizations, there's a lot more cynicism in their replies as if, they're like, of course it's going to be difficult, or of course, it's going to take this long. It's just a lot of negativity around their care rather than excitement about the transition. It's just more of a, you know, things don't matter. If I get it, I get it. If I don't, I don't type of mentality. Verbiage, I guess, more verbiage
and
that
I
way.
noticed that too, one of those things is that by not getting care before, they fall into depression, like they fall further into depression because they're not being accepted, they're not being loved, their family members haven't been there, close families maybe someone, a parent that was very close to the child, like, or now adults, has even abandoned them, which falls into the depression, anxiety, which may trigger all other factors. And then what Dr. Felix said, it's almost like, yes, they have those negative thoughts because they're so used to already not being accepted or maybe even loved, that they have this depression and outlook to life like it is what it is, because
Right.
it's fallen into a depression for so many years that they've had to maybe hide who they are, not be their true self. Like, imagine going to like elementary school or middle school, right? When there's these changes to their body where they don't feel that congruency, right, with what they were assigned at birth, with what they identify as, right? And then imagine wanting to tell your best friend, who may be your parent or sister, sibling, and they shut you down, right? So then that falls into, again, that depression, anxiety. So by the time they see Dr. Felix, it's it's like, man, we're so excited to start you on hormones, right? And they're just like, yeah, like at least one person is right now, because who knows, they're almost are expecting already for it to fail, even though down inside they, right, they're excited, they want to start the hormone because they're there, right? They want this, they want to start their journey, but they've encountered so many barriers that it's almost like,
expect it to go wrong or something to go wrong.
And then there's a whole genre of our patients whose parents are almost they are sabotaging their care, where they come in and they weren't able to have their hormones for the last 6 weeks because every time they got their prescription filled, their mom would throw it away, or they would search it, or they couldn't bring it home. So they had to leave it in the car and somebody stole it from them, or they have to leave it at another relative's house. And then transportation is an issue to get there once a week for the injection. And so it gets to split families. And so that's a lot of emotional weight to carry as a patient that's really just trying to live their most authentic, genuine self, to know that, there's this ongoing issue every week that you try to affirm who you are, but you're going to have an issue with the people that are the closest to you, the ones that should be there to support you the most. And so, I hear a lot of that, and that's splitting. It's very splitting for families and units.
And you're talking about this happening to grown adults, because the patients that we offer care are over 18 years old. So this happens
Yes,
to adults in their own family circles. Wow.
yeah,
absolutely.
let's talk about real quick, and I think we put the cart before the horse, so to speak, but let's talk about what is gender affirming care, and how does someone, what are the tests that are done? How do you know that you have an imbalance, that you want to get hormone therapy? It's not always just knowing that you're assigned a gender that you don't identify with, but it's also sometimes something else happening and maybe you don't even know, and testing reveals it for you.
Hormone therapy could be given to those who have an incongruency of what they were assigned sex at birth and with what they identify with. And the medication can go, and doesn't have to just be medication, right? There's different ways of affirming, doesn't necessarily just have to be meds. But for meds, what we do in the clinic, and in addition with additional resources, the medications help you transition into the gender that you identify as. So if you're someone who identifies as a female, right, we can provide estrogen therapy to help transition and see more of those feminine characteristics, right? Or those characteristics that estrogen could go ahead and bring. And same with those who identify as male and would like some medication to help with have more of those characteristic, right? Those outside features. Now, it doesn't only have to be for a trans woman, trans male. There's also for non-binary, androgynous. So depending on the patient's goal, we try to really target, right? So taking out that stigma of, oh, so you want female, so that means you're a trans female and you want the medications to transition to a woman. Not necessarily, no. We make sure that we are um, it's more goal specified to the patient. It's very personal to what they feel and how they want to feel so that they can get closest to what they identify as. So we could provide the hormones, we get lab work done, very basic lab work that could be done. Then we monitor you within the first year to make sure that your levels are, where they want it to be at more and a safe level, right? We monitor the safeness and we also just monitor, make sure that they're transitioning um, exactly how they expected to, right? Or those characteristics that they wanted to feel more affirming.
One of the things I like about how Sam built the program, it's not just about medication. It's not just about the state consent, So when the patients come through and they do their intake with one of our staff members, it's more of a discussion about, how's your transition going and what is your goal and what would you like to see differently? And if that means that they want, laser hair removal, or if they want, um, top surgery or anything, those resources are given at that same visit. Like, this is where you can go to seek more information. And these physicians are physicians that are, supportive and will help you along your journey. And so that's really nice too, because it really is individualized. And as patients even change their medication, there's a whole education piece, an education training session that happens before the patients leave. So, and it's individualized enough that I feel like the patients can actually voice, what their goals are, and if things aren't going well, and if they're confused about one thing or another, and they just hang and, we teach them and give them all the resources. And I feel like when they leave there, it's not just about the prescription, it's about the whole entire person and their transition.
Before we wrap up with the last part of the segment here, I wanted to ask you, Mitch, like, can you just share with us what it's been like for you to be able to even start this journey and become the person you've always felt inside? I think sometimes we get lost in all the information and trying to keep up to date, to be aware, learning the language that's used, learning the pronouns, but like we forget about the person, and just kind of like how important this is for someone who's going through this, who's living through this. Like, you never know what's happening inside a person, unless they invite you into expressing how they feel or their outlook on life. We can always be supportive, and I think there's several ways that you can be supportive of the LGBTQ community. But for you personally, Mitch, like, if you could talk about what this meant for you to just be able to like take this control of your life.
It felt amazing. I have my girlfriend of 2 years who was actually with me virtually to start my testosterone, to start my journey. My grandparents didn't really understand why I had the appointment, and why I needed to have shots every week, but they saw me grow into somebody and feel more comfortable and more confident. And I can say I felt a lot more confident once that barrier of trying to keep myself, my true self, from my family, once I could just break that down and just kind of be who I've always been, um, felt amazing. And, um, you know, I think starting the journey from what I look like and now, my physical attributes, my characteristics is really what made me happy and like overwhelmingly just like feel a lot of joy and um, like a man, because I'm sure a lot of people could relate to when they start the transition is that you kind of look like a baby when you first start, like especially trans men and trans masculine people tend to look babyish and a little bit, and they just kind of just look like they've just started the new world, and then like 2 years or anything like that, they really look like they've put on like just there's no more shows, no more barriers, nothing. It's just them. And it's been so wonderful seeing the changes, aside just from using testosterone, um, using minoxidil to get some beard going on, doing those like vocal therapies, and just getting that voice training and all that stuff. It's felt great. And uh, my mom now, sometimes I'll call her and she'll mistake me for her brother, which is just amazing. Because I look up to him. He's my godfather, and I look up to him so much. And I am just so happy to be where I am, and I'm so happy to see myself in like 5 years from now. Because changes just keep happening, and it's giving me the confidence to uh, be more social and feel confident being social. I think like without the support of my family and my girlfriend, my loved ones, and just in general, I think it wouldn't be possible for me to feel like how I am today. I have a job, I can drive a car, which 15-year-old me thought I would never be able to do. Like, because I'm like, I don't know how I'm gonna get a job. I barely talk to anybody. I barely talk to just my family in general. I don't know how I'm gonna do this. But I have a great family, and once I broke that barrier down, I felt really happy with who I am. And I think 2 years before, like past me, would feel really proud of where I am now.
And honestly, it feels amazing to hear you say all this. It makes me feel good inside knowing that you have been able to find that happy place in your life. But you talked a lot about the outward journey and like the exterior, but a lot happened inside you as well. Like you mentioned, confidence, acceptance, like, all these things that you came to know because you went through this transition. And Andre, you probably can speak more to that with the mental health background on just like the journey that happens in the mind as well, and the emotions and everything else besides the outward appearance and finally looking the way you feel.
Oh well, yeah. From my hearing of what you shared, Mitch, and thank you for that. There is a lot to be said about, in a lot of ways, gender affirming care is trauma informed. You know, you have these young people, well, some young people, some also older, who have not had their gender identity or their sexual orientation affirmed by their community, their inner circles, right? And that has all of the impacts that Dr. Felix shared earlier, that Sam mentioned earlier, of the sort of like resignation, really, to not getting the care that you need. Um, and you do see the difference that even one person can make in those instances. Like I said before, I really want parents to understand that they are the primary, like they're point number one. They're the first contact. But if you don't have that, if you don't have that parent, guardian, what have you, having a case manager, having a teacher, having a coach, having somebody who looks at you, sees you for how you see yourself, and just acknowledges that, can do a lot to keep you engaged with yourself and get you to eventually find that care. So it's you. There's nothing. There's no other alternative. That it makes such a huge impact.
Absolutely. And so while we wrap up here, I just want us to think of, how can people support, someone in their life going through this, or maybe even they suspect that someone is going through this and that person hasn't been brave enough. How can you support that from a distance, from a safe place? If they're not ready to talk about it, what are 3 things that you can do right now, or just, in the next, couple weeks, months in your life that you can do to support, the LGBTQ community?
Just be there for the person, doesn't matter what they identify, who they are, like just love them for who they are. Just being there, accepting of the person, right? Not of anything that they do, like for their personal life, just genuinely just be there for the person. And then I would say knowing your rights in the state of Florida, the importance of just electoral voting, right? With or not, with just mostly voting like within the state, your Senate, those things are so important to really know what's going on in your community. And that's what changes, right? That's what causes all these changes.
For me, I'm an acts person. I like to see people do things. So I think that if you are active in the community, it might be helpful just to let people know. So if people see you as a safe place or see you as an ally, then they're more likely, if they need help, to walk up to, to reach out to you as that person, even if you don't have the answer. So that's my big thing. I don't always have the answers, but I know Sam usually has the answers. So we can,
Yeah. And I would say you said 3 things. So first thing I would say is make sure that the space is welcoming for that, right? If you aren't maintaining the kind of space where a person of the queer community feels safe coming out, they're not going to come out. And that comes not just with like the physical trappings of the space, but then also like how are you communicating? What kind of jokes are you telling? What sort of information are you sharing? What sort of news are you sharing? How are you talking about politics and voting? All of those things, there's signals everywhere as to whether or not this is or is not a safe space for me as a queer person to fully express my queerness. Um, and then also as parents, I always say you need to welcome the child's opinion. You have to welcome their voice. So that means that yes, you're going to share your values, whatever that is. Your child may disagree, and that's okay. There's room for growth for both of you there. But if they're sharing their opinion and you disagree and you shut it down, guess what they're less likely to do the next time you try to have a conversation with them. So you have to be mindful all the time. And that sounds more intimidating than it is, honestly. You just have to just take a moment sometimes and pause and think about what you're doing.
Wonderful. Mitch, anything you'd like to add to that?
Yeah, of course. I think, all these like, the average person might not feel or even have the time to like activate social media, like, or even do it like on like face to face. I think the way to support somebody, whether it's a close one or just people around you, is just to, be welcoming, be respectful. I think being being just the average person, giving the respect that everyone else deserves is the best way to do it. I, I'm thankful to have like my mother. She educated herself, so even educating yourself, like you guys said, it's really good to just, just look up a word here and there. Don't gotta go like, full rights activist and become that. I know like everyone's got to do their own thing and everything. You don't got to do all that. You can just read about it, especially if you're a parent and you think your kid might be, trans or just queer in general. It just could be looking up what the word means, looking up what trans means and what it could do to affect your child. As a parent and as a friend, you can always just be there for them, and they tell. Yeah, of course. I think, all these like, the average person might not feel or even have the time to like activate social media, like, or even do it like on like face to face. I think the way to support somebody, whether it's a close one or just people around you, is just to, be welcoming, be respectful. I think being just the average person, giving the respect that everyone else deserves is the best way to do it. I, I'm thankful to have like my mother. She educated herself. So even educating yourself, like you guys said, it's really good to just, just look up a word here and there. Don't gotta go like, full rights activist and, become that. I know like everyone's gotta do their own thing and everything. You don't gotta do all that. You can just read about it. Especially if you're a parent and you think your kid might be, trans or just queer in general. It just could be looking up what the word means, looking up what trans means and what it could do to affect your child. As a parent and as a friend, you can always just be there for them, and they tell you or they don't, you just act the same way. You can even like hint at it towards it with you can do memes and stuff with little jokes here and there. That's like the best way to do it. If you're like just a bit more like millennial Gen Z, I guess, you can just do little jokes in here and there because sometimes it doesn't need to be that serious, and that I think that's what a lot of people think is that it needs to be this sit down, face to face, serious talk. But sometimes people are intimidated by that and don't want to do that. And it's as easy as just saying it in a normal conversation. And I think that's the best way you can do it. Just be there for them, be respectful, be kind to one another, and, just try and educate yourself here and there, you know?
I just want to remind all the listeners that you can follow us on social media at PPSENFL. That's Planned Parenthood of Southeast and North Florida. You can go to our website, ppsenfl.org, to look up our services, to see the gender affirming care services that we do offer, and just kind of check us out. Just, we're a compassionate group. We're non-judgmental. We're welcoming for everyone. We take our work very seriously, but we also are like the fun aunt that you want around to tell about your experiences and needing advice, medically accurate. I would add to that because that's another big part of what we do. No conversation is off the table when you're talking to your healthcare provider or, our behavioral health team, anyone really on our team. Like we're open and listening to all perspectives and all experiences and really listening to what you need for us to help you on your journey, on your healthcare journey, because everybody's on a different journey, right? So I thank you so much for being a part of this. Happy Pride Month. Please go out and read more about Pride, how you can support someone in your life or a loved one, or even if you don't know anyone, just support the LGBTQ community in general. Thank you so much for being here. Have a great day, everyone.